Hey, everybody, and welcome to a new episode of Frank About Health. It is October 3rd, 2024, and October is Breast Cancer Awareness Month. That is, in fact, the name of this episode. Overall, I'm happy to be here again with Karen. Unfortunately, I'm sorry, Karen, that I'm not in Chicago, but I promise November I will be there. But
Well,
at the
I
same
hope so. I miss you. And we always have a nice dinner after the show.
time,
So
I'm even
we'll
thinking of the chicken pot pie we had last time.
very good. Sounds like a
Like
plan.
like a plan. But I'm also here. Thanks again to Karen, and thanks also to James Haynes, who represents integrated marketing. He's the director of integrated marketing at the American Cancer Society, who brought two special guests onto the show today that are medical professionals who have been focused on cancer research, cancer cures, cancer studies, demographics, other ethnographies. The list goes on. But again, we are talking about breast cancer, but the American Cancer Society represents all types of cancer. And for those of you out there who know that my father has been recovering from prostate cancer, I obviously am going to be taking a student view of this particular program. That being said, in segment one, we're going to hear first from Dr. Kathleen Goss, who is going to talk about what the American Cancer Society has been doing over the past few months, few years, just in general, and how we look forward, how we are going to be looking at cancer in the future. And then we will hear from a radiologist a breast radiologist in segment two, who's going to also show some facts and figures. And thanks to the technology of Zoom, I'll be able to help display some of those pieces of information. Now I have to issue my disclaimer, but it's not a typical disclaimer because, quite frankly, this is a medical program for the first time in the 3.5 years that I've been doing this podcast. So therefore, this episode does not represent the views or thoughts of Frank About Health or TalkRadio.nyc, but you will learn throughout the hour, through medical research and through facts and figures, how the American Cancer Society is representing the country in helping to find solutions and advocate for all types of cancer. So I hope you enjoy what we will present over the next hour. So that being said, Dr. Goss, I'm going to open up the floor and let you take over the show and educate all of us. And welcome.
Awesome. Thank you. Thank you, Frank, so much. And Karen, it's a thrill to be here. And know it's going to be a great program. So, in a really important discussion, this month is so valuable for really raising awareness across the country just about breast cancer facts and figures and screening and the importance of taking care of yourself and also advocating for those that you know that have been touched by breast cancer, and also sharing the great work that all of us are doing to really reduce the devastating effects of this disease. So I'm really thrilled to be here. And what I'd like to do is, in the next few minutes, is really share what the American Cancer Society does to tackle this problem. And and I'd really like to highlight our three mission, what we call pillars: advocacy, research, and patient support. So I'll talk about each of those. But let me at the outset start by saying our mission is to end cancer as we know it for everyone. And that for everyone piece is really, really important because we know that there are so many, and you doing this show, Frank, I'm sure you have talked about, there are so many inequities and challenges and barriers for people to access care for a variety of chronic diseases and other things. And so it's really important that we are sort of at the hallmark of everything. The center of everything is that we want to make sure that we're addressing those inequities. So
Yes.
let me just touch on the advocacy piece. So we have a sister organization called the American Cancer Society Cancer Action Network. And this is an advocacy part of our organization, which really works at all levels of government to advocate on behalf of public policies and advanced public policies that support things like access to care, to cancer care, as well as cancer research. And so just one example that's really, and that's in all 50 states. and in Guam and in Puerto Rico that we do this work. But one just example that is really important from a breast cancer standpoint is protecting federal and state funding for programs like the CDC's National Breast and Cervical Cancer Early Detection Program. So there are in each and every state, the CDC program has local programs in which people can access for free and discounted care if you're uninsured or underinsured. So that's really, really important for that piece about improving access for everyone. So that advocacy piece is really so important. Let's talk about research. That's what's near and dear to my heart. I'm a cancer researcher by training, and I'm really lucky at the American Cancer Society. I get to run part of our extramural or external research program. These are grants that we give to investigators all over the country to do really groundbreaking cancer research. And so we're currently funding about $450 million in research across the country. We're the second largest funder of cancer research next to the federal government. So we give out a lot of dollars to research, and over the last several decades, it's actually added up to about $5 billion in research that has gone out the door to institutions across the country. Specifically in breast cancer, right now, we're funding about $76 million in breast cancer research. And over the last 30 years or so, we've funded more than $420 million in breast cancer research. So, and this is in prevention, detection, treatment, and survivorship. So all over that care continuum for patients. So that research piece is so important. But what people might not know is that we also have an intramural research program at ACS. So inside the organization, we have an outstanding world-renowned research team. And they are ones that are really focused on what are the root causes of cancer, what is the impact of behavioral and environmental risk factors, and what things like social drivers of health, what things influence outcomes. So how how can we reduce some of those factors and improve outcomes? They're also responsible for doing things like developing evidence-based screening guidelines. So we know that screening for breast cancer is critical to detect the disease early, and you're going to hear much more about that from my colleague Deepa. There are scientists at the American Cancer Society who review all the evidence out there from studies and say, okay, well, what should the screening guidelines be? And I know they can be confusing for people, but it's really important that they are evidence-based and that we spread the word about those screening guidelines. And we have screening guidelines for other kinds of cancer that we can screen for. But in breast cancer, let's just review some of those screening guidelines really quickly. And it's important to recognize that this is for average risk patients. So Deepa is going to talk a bit more about what it looks like for those patients that are higher risk. So you have a family history of breast cancer or other factors that make you at higher risk. But if you're at average risk, then between the ages of 40 and 44, our guidelines recommend that you have the option to get screened. So that you should talk with your physician about getting a mammogram every year and starting your annual mammogram during that time period between 40 and 44. Of course, during between ages 45 and 54, our recommendation is that women are getting screened every single year. And that's really important. The every year piece is really important so that if any changes are seen, that they can be followed up on quickly. And so again, the goal is to detect anything abnormal, detect that early. And then for ages 55 and older, that you can, the recommendation is that you can switch to screening by a mammogram every other year if you'd like, or you can continue to do it every year. So again, this should be a conversation with your physician about whether or not you should continue every year or go every other year. And this should continue until, you know, as long as the woman is in good health. And really what we say is if someone is expected to live at least 10 more years, that screening is really, really important. So I think it's always, I know it's a hassle for women to remember to schedule their mammograms and be really on top of it, but it's incredibly important. As we know, it really saves lives.
Yeah.
The other thing that I just wanted to be sure that I talked about in our research program is that we have a team that is focused on surveillance, health surveillance, and health equity. And they just produced, just a couple of days ago, this new paper, a new report that was specifically focused on breast cancer facts and figures. And you're going to hear more about some of the statistics, but I wanted to really highlight a couple of key findings from that study since it just came out. Certainly, we're really proud of the fact in the cancer community that breast cancer death rates have dropped significantly over the last several decades, but not every population is benefiting from that. And so it's really important to recognize that especially American Indian and Alaskan Native women have high rates, and that there are other disparities, especially in young women, in that population and in others. And it's really important also that while Black women often have the same incidence of breast cancer, their mortality is significantly higher. So obviously, there are lots of things we can do to address that.
You have a slide to show on that, don't you?
I don't have a slide to show on that, but actually what I am going to share is that we are doing a study to try to figure out why that is and how we do something about that. So I'm going to share let's see. This is the one I wanted to show. Hope you can see that. This study called Voices of Black Women. So this is a what we call a cohort study, and we're recruiting women who have never had a breast cancer diagnosis, but can participate so that we can follow them over time, and they complete surveys so that we can touch on what is causing their breast cancer, what's increasing their risk of breast cancer over time. So this is, and other kinds of cancer. So this is just one example of that of the work that we're doing. I'm going to wrap up. I know we need to, you're going to kick me off and go to break. But let me just share an important piece of what ACS does too to support patients and their families is education. So I'd encourage people to go to cancer.org. We have some screening resources here at cancer.org/get screened for, you can find screening providers if you don't know where to go in your community. We also, this is what it looks like. You can screening location near you. And then another tool that I wanted just to show really quickly, and this is all through our cancer.org website, is this Defender tool. And this can help you look at your at what screening tests are right for you. Actually, this is through a partnership with the NFL called Crucial Catch. So you just take a quick online tool quiz, and it can help you see what screening, you know, what risk you are, and then what screening test is right for you. And then the last thing I just want to show is this new app that we have that's called ACS Cares. And this is just one way to access all the resources that we have if you've been diagnosed with breast cancer or someone that you care about has. It's an app that you can download from the App Store. And then it's as if you've got all these tools right there in your hand. to help navigate this really tough journey and give you the information that you need. So anyway, I will stop sharing that and let you move on to the next segment. But I just wanted to thank you again for allowing us to talk about the American Cancer Society and our mission and all the resources that we have available.
Well, it was my pleasure, and I will do you justice by during our first commercial break. I will show that website for everyone to look at, including how to reach out and stuff like that, almost like I'm doing an entire tour of sorts. But more importantly, I already have one question, which I will ask you when we return, and then we will hear from our breast radiologist, Dr. Deepa Sheth. So, ladies and gentlemen, please stay tuned as Karen and I are celebrating on Frank About Health Breast Cancer Awareness Month. We're not only celebrating, we're advocating and educating. So stay tuned right here on TalkRadio.nyc and on our socials, YouTube, LinkedIn, Facebook, and Twitch. And please, if any of you out there have any questions, this is almost like an educational seminar. Ask away, and we will be there to answer them live. So we'll be back in a few. Stay tuned.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on TalkRadio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on TalkRadio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on TalkRadio.nyc.
If you don't have your health, what do you really have? It's time to feel good in your body and shift from struggle to ease. Hi, I'm Elizabeth Tripp, your host of Nourish the Soul, where we explore the sacred wisdom of your body while you sit back, relax, and go on a journey of self-discovery. Join me every Tuesday at 6 p.m. Eastern Standard Time to awaken your heart, transform your well-being, and unlock a deeper understanding of yourself.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Hey, everybody, and welcome back. I hope I did justice during the commercial break as I went through each link and the phone number. Good. I'm glad. But I did have one question. You were referencing the article, the new ACS report about breast cancer mortality. I'm looking at it right here on my side computer. Can you give a little bit more information on that? Because, I think I did mention in the early part of the program, it was a very interesting 3.5 years watching my father go through and mix medications and actually at age 93 recover from prostate cancer. There are the side effects that are expected, especially at his age, but they're manageable. And trust me, with other stresses that are going on, health-related stresses in my life right now, that I can actually put at the bottom of my bucket list because I know that he's been taken good care of. But that being said, he would be a misnomer, or he would be the what's the right word? The exception.
Outlier. Yeah.
The outlier, thank you, to the mortality rate research that you've done. So would you like to address how my father might fit into that kind of situation?
Yeah, we know that these types of population studies are so important because it gives us a really high level view of what's going on in a population. But we know that that's just a really high level view, and that there are individuals with each of these that are represented here. And sometimes there can be outliers. But what's important is that when we monitor these statistics over time, we can see changes in both incidence and mortality. These trends are so critical because it tells us what we need to do moving forward. So, as an example, I mentioned this difference that we're seeing for American Indian, Alaska Native women that are getting cancer earlier, and it's really deadly for them. And it's so important because it says, well, maybe some of our intervention efforts need to focus specifically on those populations. There are other data from our recent general cancer facts and figures that told us that early age onset colorectal cancer is a really important emerging problem. So, so now we need to focus on screening those younger people. So my point is that by following these trends, it's so important to guide our next steps, where we need more research, where we need interventions, and where we need to educate and focus on really both the professional community as well as the general population about awareness and reducing risk. So I think in general, it's fascinating, but we have to realize this is just averages and that every individual is so different.
Amazing. Well, now we're going to hear from our resident breast radiologist, Dr. Deepa Sheth. I know you work with the American Cancer Society, but you're affiliated with a different hospital system, correct?
Yeah, well, first of all, thanks for having me, Frank. Karen, what a pleasure to be on your platform and get to sort of talk about that, which I'm so passionate about, breast cancer. I really want to make it my mission to educate and spread awareness about breast cancer. And although October is certainly the month for breast cancer awareness, we want to sort of continue this conversation year long, and keep talking about it and making sure that people are aware about it. So I appreciate you guys taking time apart, to talk to me and Kathleen about this. I've actually been involved with the American Cancer Society since I was a resident. So in 2015, I got granted a Young Investigator Award, what Kathy was talking about, like inspiring and fueling research initiatives in young physicians. And so, yeah, the rest is history. I've been with them since then. And now that I'm working out in private practice, I really get to see everything that Kathy's talking about. And so let's sort of talk about breast imaging. Let's demystify this fear that people may have about mammograms and cancer and what does it involve? So first of all, I'm a breast radiologist, and that means that I am the first person that's going to detect this cancer on your screening mammogram, right? So it is my job to detect it at its earliest stage possible because we know that's what leads to the best overall outcomes. So when you come in for a screening mammogram, and based on the guidelines that Kathy kind of, mentioned, right? So you're going to start at between 40 to 45, depending on your risk. You're going to come in for a mammogram and you're going to get 2 images each of your breast. And then you're going to go home. And then your radiologist is going to read these mammograms on a separate day and then send you a report in the mail, letting you know that whether something is fine and I'll see you next year, or whether there's something there and I just need some more images. So come on back so we can do a few more images.
Right.
Now, breast cancer statistics, right? We know that 1 in 8 women will get breast cancer in their lifetime. 1 in 8. I want you to think about that. I think about your mother, your sister, your daughters, your nieces, your grandmother. That's probably 8 women right there in your life, right? So 1 in 8, that's a really high number. And that's just the average risk for breast cancer. And we know that this year alone, 330,000 women will be diagnosed with invasive breast cancer. So it's a huge problem. And so when you come and get diagnosed with that breast cancer, or you come in and get a mammogram that's abnormal, you're going to come in to see me again, and I'm going to do a biopsy, and we're going to help diagnose what kind of breast cancer you may have. Now, when we talk about risk factors, Kathy was talking about risk factors and how we can modify some of this. There are certainly things that we can modify with breast cancer and things that we can't modify in terms of our risks. So things that we can modify and help decrease our risk, things we've all heard before and things we don't want to hear, like maintaining a healthy weight, eating right, walking and exercising, things those all actually modify and decrease your risk for breast cancer. There's also some unique ones, that are inherent to women. And so actually having children at a young age, that can decrease your risk for breast cancer. Breastfeeding, that can decrease your risk for breast cancer. But then there are things that we can't modify, right? Unfortunately, being a female, that alone is greater risk for breast cancer than being a male. And we'll talk about male breast cancer in a little bit. But being a female, aging, as you get older, your risk for breast cancer increases. So every decade, you have a greater chance of breast cancer than the decade before that. Getting radiation as a child, from like lymphoma, that's a risk factor for breast cancer. Yep. And then the last thing is this new concept called breast density. And Frank, this is where I'm going to need your help in a second here. I'm going to need you to jump in and show that schematic. And so what is breast density? This is a term that radiologists use to describe the density of your breast. And as we're going to see in just a second, I can't look at you and know what your breast density is. It's not something I can see. It's not something I can feel on a physical exam. It is purely a term that we see based off of your mammogram. And so hopefully everyone can see the schematic, but this shows 4 different breast densities. And going from the left side of the screen to the right side of the screen, I hope you can appreciate that the mammogram appears to be getting whiter, right? There appears to be more breast tissue in each of these mammograms. And so I'm not sure, Frank, if we can make it even bigger, just so everyone can see the differences between them. Yeah, there you are. Okay, so perfect. So you can see breast density comes in 4 flavors, 4 categories. And as you increase in the breast tissue, which is the white area on that mammogram, your breast density increases. And you may ask what that gray area is then, right? So it's a combination of this white tissue and this gray tissue. The gray tissue is your adipose or fatty tissue. And so as you increase in the white, the density increases. And why am I like hemming and hawing over this breast density? We know that having increased breast density or having whiter breast tissue, as you can see on the right side of the screen, leads to an increased risk for breast cancer. And so if you put 2 DIPAs, right, 2 of me, one with low breast density and one with high breast density, but I'm matched in age, I'm matched in my background, I'm matched in my lifestyle. The DIPA with greater breast density has a 4 to 6 times more increased risk for breast cancer than the DIPA with low breast density. Now, we have new guidelines. The federal government has issued new guidelines that every patient needs to know about this. This is so important that everyone needs to know about this. So starting as of just this month, we have to put your breast density on your mammogram report, and we have to send a letter to your home with your breast density. So I want everyone that's had a mammogram recently to go home and see their breast density. Because if you do, you need to ask your radiologist to get additional testing, like an additional ultrasound exam or an additional MRI exam, because you have that increased risk for breast cancer. And just to kind of put some numbers to this, we know that 50% of the population has dense breast tissue. So this is a huge issue. So go home, read your mammogram, find out what your breast density is. And then I know we're getting to a commercial break, but we can quickly talk about male breast cancer at the end of this segment. But I just want you to know that men can get breast cancer too. And so we'll talk about that.
And let me now stop sharing this so we can go to our commercial. But I did want to find out something from you based on male breast cancer, actually. Oh, good. I stopped sharing. I'm just kind of interested to know, and then we'll go to the commercial break. How does a man get tested for breast cancer? They don't have the tissue to go through a mammogram. So that, I don't know, for the interest of the break, let's do that. And then when we return, oh no, wait a minute. We have somebody possibly coming in soon. So quickly answer in 10 seconds. What's the kind of test that a man has to go through?
Men can get breast cancer. The most common way they present is with a mass. And so if they feel a mass, they're going to come in. They can and do get a mammogram with me so I can evaluate their breast tissue, and then they will get an ultrasound. Generally, on average, men are at risk for breast cancer 1 in 700. So it's very rare, but it's not 0, right? So if you have a persistent mass, you need to come in to get a mammogram and an ultrasound so we can check it out and get to the bottom of it.
Amazing. So ladies and gentlemen, I have nothing left to say because I think that I'm just sitting here, as I said, as a student, but I'm very grateful to the work and the presentation that both Dr. Kathleen Goss and Dr. Deepa Sheth has presented. And I hope all of you out there are learning a lot as I am. Again, if you have any questions, please email us through our YouTube channel, LinkedIn channel, or our Twitch channels. We will be back in a few.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.nyc.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on TalkRadio.nyc, and I will continue to be frank about health with all of you.
If you don't have your health, what do you really have? It's time to feel good in your body and shift from struggle to ease. Hi, I'm Elizabeth Tripp, your host of Nourish the Soul, where we explore the sacred wisdom of your body while you sit back, relax, and go on a journey of self-discovery. Join me every Tuesday at 6 p.m. Eastern Standard Time to awaken your heart, transform your well-being, and unlock a deeper understanding of yourself.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Well, and don't worry, anybody. Both Dr. Gross and Dr. Sheth will be back in the fourth segment to just kind of.
Hey, everybody, and welcome back. So now, Karen, take it away.
Okay, and I want to tell everybody to know that Dr. Sheth and Dr. Goss will be back in the last segment and just kind of tie up things and give us the most important information. But the one thing that I want to talk about today is one of the programs of the American Cancer Society, which is their Portrait of Hope. And this is a wonderful platform that honors survivors of breast cancer. We have one of those people with us today, Lindsay Johnson, and she's going to tell us more about her personal journey and more about the Portrait of Hope and how people can maybe get involved in that part of the organization. Thank you, Lindsay, for joining us. And if Dr. Goss or Dr. Sheth have anything they want to cross in while we're talking, we welcome them to do that. Thanks, Lindsay, for being here.
Thanks for having me. So again, I'm Lindsay Johnson, and I am one of the 8 Portraits of Hope. This is the first time in Chicago that we are doing this program. The 8 of us are survivors and thrivers of breast cancer, and our goal is to educate and inspire and to hopefully help other people who are affected by breast cancer. And just promote awareness as much as we can. And yeah, that's the gist of it. We actually have a walk coming up soon, tomorrow from Saturday, and it's going to be a really fantastic opportunity for those of you who are in Chicago. Come on. But yeah, so this has been a really beautiful opportunity for me to take something that was very challenging and turn it into something hopefully positive, in that if there are people out here that are listening to this that have been diagnosed and are younger, they can see that you have an end in sight. There is hope and there's life on the other side of this very challenging time. It was clearly the most challenging time of my life. I don't even really know how to put words to it yet. It was still relatively recent. I was in treatment about a year and a half ago. So this is still quite fresh. But yeah.
How old were you when you were diagnosed?
I was 38 when I was diagnosed. And it's interesting. My story, I find, is like the best one to share with people who are younger, because it's very typical in that my mother, unfortunately, did have breast cancer, but it was after menopause. She is alive. She is great. She is kicking. She is wonderful. And therefore, when I was going to see my doctors forever, because she had had her cancer after menopause, they thought, oh, there's no way that it's hereditary. There's nothing there. Don't worry about it. This was obviously a long time ago. And then when I was in my mid 30s or so, I switched doctors and ended up going to see a new gynecologist who said, you should really go get genetically tested. And I said, yeah. Okay, I'll totally do that another day. And it took her about a year and a half of pushing me to finally get me to go. And I don't even know how to thank her now, because had I not, I don't even know where I would be or if I would be here. What I did find was really interesting in that I do have a genetic marker, but it is not the BRCA gene that everyone knows. It is a genetic marker called PALB2, and it is linked to breast cancer, ovarian cancer, and pancreatic cancer. And it is something that I was so excited to see both of these wonderful women know thoroughly inside and out. And because I've had conversations, and there's still quite a few people in the medical profession who don't know it yet. So it's something that's very, very new, but not new, but we just know about it now, I guess. So I found out that I had this genetic marker, and just the high risk clinic, which was fantastic, set me up with early mammograms. So I ended up getting my first mammogram at 38, and after that period, at 37, excuse me. And during that year, they gave me all those different types of imaging. So there were breast MRIs, ultrasounds, just regular physical manual exams from my doctors. I joke that no one was paying attention to these boobs nearly as much as my doctors were that year. And I didn't think anything of it. I just was trying to go with the protocol of what they told me to do. And, when I had my first mammogram, I had very dense breast tissue, as you were just discussing. And the doctors thought that there might have been something there, and did some extra imaging and didn't find any evidence of anything after that. So I had my first dense breast tissue kind of scare, in that it's hard to see, but also now that we know, it's a higher chance of diagnosis, which is I didn't know until today. That said, I lost my train of thought. Yep, there we go. So, so I had a great time with all these things, but nothing was starting to show up within, the 3/4 of a year. I had just been to the doctor, and then 6 weeks later, my now fiance, he said, "Honey, I think you need to pay attention to this." And had he not said something, having dense breast tissue, having lumps or bumps or things wasn't particularly abnormal. So this mass that I felt, I could have very easily ignored. I'm too young. This is silly. This is how my breasts always feel. That was clearly not the case. He was very adamant, and I'm extremely thankful for that. And we found was that the lump itself was not actually cancerous, but the cancer was behind it. And so I don't know where that lump came from, what it was, how it got there, but just say thank you to whoever and whatever made that happen. Whether it was my body, whether it was something else, I don't know. But the cancer was in invasive ductal carcinoma, stage 2. It was estrogen and progesterone positive, but not HER2 positive. And I ended up having a double mastectomy, and then 4 rounds of chemotherapy with Taxotere and Cytoxan, and then reconstructive surgery, thankfully. And I can't even describe the process at all. I'm still processing it myself. But the people that I met that were a part of this community who were here to help were unbelievable. There were such phenomenal gifts to people who are going through some things like anything like this. And I was very fortunate because I had a very loving community that rose up and surrounded me and the things that my best friends sent me from, care packages from far away, and, my mother and my fiance and everyone underneath the sun was here and listening and talking. My coworkers were insanely helpful. The things they thought of that I needed, I would have never in a million years considered. But not everybody has that, and one of the things that I find really impactful about what the American Cancer Society does is that there is, obviously there's fundraising elements that go towards our research and trying to, make additional advances, but there's also just volunteer opportunities. So if you can't donate money, you can donate your time. And chemotherapy is not a very fun couple of hours or full day, or depending on however you're receiving the medication. And you can volunteer to go and sit with someone. You can volunteer to drive someone home from their chemotherapy. I think that level of volunteer for those who can't find any way to volunteer monetarily is just unbelievably impactful. And I highly, highly encourage everyone to look into other avenues if they can't do even things like that.
That's a great idea. Would they do that through the American Cancer Society if they wanted to do that kind of volunteering?
I believe so, right, Kathy?
Yes. Please.
Okay.
Yeah,
and just a little bit more about the Portrait of Hope.
Yes. So this is the first year that we're doing this in Chicago. Right. So it's really exciting. And the 8 of us are in all walks of life. And we are going out into the world and trying to raise awareness and inspiration and give support and, fundraising and advocacy for the American Cancer Society. And each one of us is out doing things like this, so we're speaking to companies, we're speaking on the radio, we're on the news. I have been luckily the podcast girl, so this is my second podcast. I'm feeling great. Great. I'm happy to be here. And yeah, it's a wonderful program, and the Portraits of Hope is the right descriptor for it, because we really are here to try to show that there is hope in this very challenging part of life.
That's great. Kathy, I think I interrupted you. We have another minute. How would someone go about doing that kind of volunteering?
Yeah, so we have lots of opportunities. So I would encourage folks to go to cancer.org and look at volunteer opportunities. But a couple things that come to mind based on what Lindsay talked about. Road to Recovery is a volunteer program to provide transportation to cancer patients who need support getting to and from treatment. We have a program called Reach to Recovery that is a peer-to-peer program for individuals with breast cancer, so that they can identify with someone who has a similar lived experience. And so that's a really powerful way of getting involved. And then in a lot of communities, not in Chicago yet, but in some communities across the country, we have some Hope Lodge facilities that provide lodging for cancer patients and a caregiver for free. And we're trying to bring one to Chicago. There's one in New York. And there's 30 others across the country, but this is a great opportunity to volunteer and things like that for those that are staying at the lodge. So lots of volunteer opportunities, of course, and then the fundraising piece is always important, because what we say is no mission, no money, no mission. Sure. So thank you for bringing all of that up.
Thank you. Frank, I think we're up for another break, right?
Yes, we are. And I do have 2 questions, but I think they'll be perfect for wrapping up. So ladies and gentlemen, please stay tuned as we are wrapping up this episode of Frank About Health in the final segment, right here on TalkRadio.nyc and on all of our socials. We'll be back in a few.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on TalkRadio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on TalkRadio.nyc.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on TalkRadio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back. And now we want to hear from Karen. Basically, I know you have some experience in working with cancer patients, so by all means.
Well, thank you, Frank. And people might ask a logical question. I'm a hypnotherapist. What does hypnotherapy have to do with cancer treatment? And it is not a direct involvement, but it can really help an individual go through that journey, go through that process with more ease and a more peaceful attitude about it, and just make it an easier journey. Just very, very quickly, recently worked with a young woman about your age, Lindsay. I think she was 36 when she was diagnosed. She also had a double mastectomy, did chemotherapy, radiation, and has come through, thankfully, beautifully. And she's got a young child. And so it's such a disappointment when it strikes someone like that. But what I did with her was to do some hypnotherapy and then give her a recording that she could listen to on a regular basis. And what she said about that was, Karen helped me get through some challenging aspects of my cancer treatment this year. She made recordings for me that were beautiful and soothing in multiple layers. I felt so heard from everything she said and experienced synchronicity when she also said just the right things beyond anything I shared. I can't speak for other hypnotherapists. That's how I, though, approach the situation when I have a client in that situation. And I listen to them and give them the ease and effortlessness that they need to get through the process. So if anybody in our audience is going through this, knows anyone, it's worth a conversation. Just reach out to me through my website, KarenRossNow.com. You can send a direct email to me at info@KarenRossNow.com. It's worth a conversation to see if I can help, and that's what I'm here for. So, Frank, I'm going to pass it back to you for everybody to share their closing thoughts. But what a great show! What great guests! Thank you so much for being here.
Yes, absolutely. Well, Lindsay, first and foremost, I do want to ask you about that gene that you said in the last segment that was also I don't know if you call it a primer or a trigger for pancreatic cancer as well. Now that you've already had that gene materialize in terms of breast cancer, does that mean that you're still at risk for those other cancers? Or has there been a treatment modality put into place for you that can hopefully minimize the risk of those ever coming to light?
So at this point, it's just early screening, and some preventative things, for like the ovarian cancer piece, I will likely have my ovaries removed at some point, but pancreatic cancer, I'm just going to have to start screening as early as I possibly can. But that is something that they have said that I am still in a younger age group, so it's not their front of concern for them, but I know it'll be probably sooner rather than later. Yeah, it's a very interesting thing. I just leads me to the one thing that I feel like I really need to say before we close is that please just go get screened. Just do it. I mean, it sounds terrifying. But also think about how satisfying and relieving it'll be if there's nothing to be found.
Correct. It's when you know that you're okay, or that, okay, we're just going to continue year over year, that you're on a trajectory of some sort, that
Yes.
knowledge is power. You have less fear, and you
Yes.
just know you're following the right prevention and the right modality of keeping yourself as healthy as possible.
Right.
And you know,
Yeah,
I mean, you're now in remission, correct?
I am. Yes.
I'm happy for you.
Thank you.
Dr. Sheth, now we had this wonderful display on dense breasts, and obviously we heard from Lindsay that was one of her situations. One question that came to my mind is that what is the basis of the breast density? Is it genetic, or is it environmental, or is there something else that maybe individuals, even men, could possibly minimize the density issue from being a big risk factor?
Yeah, first of all, Lindsay, thank you for sharing that really heartfelt and, just compelling story. I think it's so brave of you to go out there and share your story, because it really does help us kind of convey that message. Come in for your screening mammogram. We want to see you. We promise we'll try to make it as painless as we possibly can. A lot of people during COVID sort of fell off that wagon of getting screened. And we want to just remind everyone, hey, it's time. It's time to come back. We miss you. And so that's my one PSA here. Come back in to get your mammogram. But yeah, breast density is not something that you can modify. It's just based on your genes. So Lindsay, your mom may probably have had dense breasts. Your grandma may have had dense breasts. There are a few external things that can change your breast density, like getting radiation therapy can decrease your breast density, or starting hormonal therapy after menopause can increase your breast density. But those are external, like you can't control that, but your breast density is just part of your genetics. And then secondly, I just wanted to touch base on this personalized risk. Like many women are probably saying, well, you said to start at 40, but Lindsay unfortunately got diagnosed at 37, And so we're actually saying that when you're in your 30s, like ideally 30, we want you to have a conversation with your primary provider and talk to them about, hey, I have a strong family history of cancer, not necessarily just breast cancer. Tell them about all your history of cancer. And what they'll do is they'll refer you to a genetic counselor, and they'll do a full pedigree of every family member in your tree and what kinds of ailments they may have. And if they find that you're eligible, they'll do some genetic testing on you. And we now know that there's over 90 genetic alleles that lead to increased breast cancer. 90, right? So it's not just the BRCA1 and 2 gene that we've heard about like in Hollywood these days. It's PALB2, it's CHEK, it's ATM. There's over 90 of them. And knowledge is power. So now that Lindsay knows about this, she can get the right surveillance tests and the right early imaging before she, God forbid, gets anything, so that we can catch it as early as possible.
Okay. No, I mean, and Dr. Goss, I was very inspired by how you opened the show in terms of all the advocacy for different groups and communities. But more importantly, I guess just the kind of research that I see you doing, or I see the American Cancer Society doing, I guess I do have questions like, how is AI working into it in terms of future cures or solutions, or even the research itself?
It's such an exciting time in cancer research, and I know Deepa feels the same, is that, we are really at a transformative place because of technology, because of data, because of AI, and being able to really mine data in new and exciting ways and learn as much as possible. So there's a lot to be excited about for what's ahead. And that's important because breast cancer is not just one disease, it's multiple diseases. Lindsay talked about the profile of her breast cancer, and there are lots of different ones, and they behave differently, and they respond to treatment differently. And so the research is so key, not only for us to understand what causes breast cancer, how do we prevent it, how do we test those new technologies to detect it faster and easier and more reliably, but also how do we treat it better, because they do behave differently. And frankly, our goal is not to just have people live longer, but to have them live better. And so it's about improving quality of life for survivors as well. And so my PSA is going to be really about, because you guys beautifully talked about screening and knowing your risk. I guess what I would just say, if you're going through a cancer journey, make sure that you know that you have people and resources to support you. And Lindsay, thank you so much for bringing this up, because not everybody has that. But you can, the American Cancer Society is just one organization, but we have a 24/7 call center that you can get somebody on the phone and talk to them about your, what you're having trouble with from a healthcare perspective, to insurance coverage, to, hey, how do I find out, the closest pharmacy? And so that call center is so important. Things like, we have a program called Ever You that has wigs and hats and scarves at a really reasonable price. So again, helping women live a better quality of life through this journey. And then my last thing is just get involved. And so we mentioned at the outset to support Breast Cancer Awareness Month at the American Cancer Society. There are Making Strides Against Breast Cancer events all over the country. And so get involved, attend, fundraise. It's a part of a really amazing community. And so you won't regret being a part of it. And thank you in advance.
Well, we're going to have to wrap up the show. We have less than a minute left. But first of all, thank you, Karen, for introducing the Frank About Health platform to James Hearn. Shout out to that man who put all of you together for today's show. Thank you, Logan, behind the scenes, for all the editing and technology work that we were able to do to make this show as informative as possible. I want to thank also, just in general, the technology that's out there. In fact, my last week's show, I talked about specific cultural programs, health-related, medical inspiring shows, and Million Little Things was one that talked about male breast cancer, which I know Karen was also a fan of. And the way the series ended was he died from it. I guess there's a lot more research that needs to be conducted when it comes to male breast cancer. Now, that all being said, we're about to sign off, but I do want to announce that tomorrow's episode, tomorrow, Friday's slate of shows, is only Tommy D's Always Friday in the Morning. I'm sorry, Tommy D and Philanthropy in Focus. And then next Tuesday, we have The Hard Skills and Nourish the Soul. And then next Thursday, after the Conscious Consultant Hour, Mind, Body, Health, and Politics, will be another episode of Frank About Health. So, ladies and gentlemen, thank you for all being here and listening to the show. This show will be ready for playback at any time. And if you have questions, then you can send them to me at frankrharrison1@gmail.com. And also, I guess we'll see you all next week. Thanks again for celebrating Cancer Awareness Month.
Thanks, Frank.
All righty. Bye-bye.
Bye.